Understand Temporal Mandibular Joint, or TMJ, by SmartDX Media. SmartDX Media or Studio made this animation, and you can get a month trial for free, and also to download thousands of health imagery and videos by visiting the website in the description below to request for access. TMJ disorders are issues with jaw's joints and the muscles that aid chewing. On both sides of the head, there's one joint about where the lower jaw fits to the skull. One is sited immediately behind each ear, and the lower jaw bones are held together by these joints, which allow us to chew food. A spongy pad called a disc sits between the temporal bones of your skull and the rounded ends of your mandible, and the discs slide forward when you open your mouth and back into place when you close it. Muscles are attached to the mandible and control its movement. The TMJ can open and close like a hinge, but unlike many other joints, it can also slide forward and back and side to side. What is temporomandibular joint, TMJ, syndrome? Picture of temporomandibular joint, TMJ, syndrome. TMJ syndrome is a kind of jaw pain that can be caused by a range of medical conditions. The TMJ connects the lower jaw mandible to the skull in front of the ear, temporal bone. Some facial muscles that affect chewing are located in the lower jaw. Abnormalities in this area can cause head and neck pain, facial pain, ear pain, headaches, a jaw that is locked in position or difficult to open, biting difficulty, and jaw clicking or popping sounds when you bite. Temporomandibular joint disorder is another name for TMJ condition, TMJD. TMJ is more common in women than in men. Other, less common health issues can also cause joint pain, such as teeth grinding during sleep. Symptoms may include difficulty moving your jaw, clenched teeth, and a noise upon opening or closing your mouth. There will be changes in the way your teeth meet. Note, if you have any questions about TMJ, talk to your doctor. Put your fingers in front of your ears and open your mouth. You'll be able to feel the joint and its movement. When you open your mouth, the rounded ends of the lower jaw, the condyles, glide along the joint socket on the temporal bone. The condyles slide back to their original position when you close your mouth. In order to keep these joints flexible, you can find a few small discs of cartilage lying in between the condyle and the temporal bone. The shock-absorbing discs cushion against shock coming from chewing and other movements. Chewing creates a strong force. This disc distributes the forces of chewing throughout the joint space. What is the main cause of TMJ? Excessive strain on the jaw joints and the muscle group that regulates eating, swallowing, and speech is sometimes the main cause. Also, this tension could be caused by bruxism, and the involuntary clenching or grinding of teeth is known as bruxism. TMD can be caused by trauma to the jaw, head, or neck. What TMJ syndrome? The TMJ connects the lower jaw, mandible, to the skull, temporal bone, in front of the ear. TMJ syndrome can be caused by trauma, disease, wear and tear due to aging, or oral habits. Trauma is divided into two types, macrotrauma and microtrauma. Teeth grinding, bruxism, and clenching are examples of internal microtrauma, jaw tightening. The teeth may slip out of position as a result of the continual hammering on the temporomandibular joint. Muscle involvement causes inflammation of the membranes around the joint. Patients with temporomandibular joint discomfort or facial pain that includes the chewing muscles might be diagnosed with teeth grinding and clenching, myofascial pain. A punch to the jawbone or an accident impact can shatter the jawbone, dislocate the TMJ, or damage the cartilage disc in the joint. Dental that causes the joint to be pushed open for long periods of time might cause TMJ pain. After a dental procedure, massage and heat application can be beneficial. Bruxism. Bruxism, also known as teeth grinding, is a behavior that can induce muscle spasms and an inflammatory response, which can lead to pain. TMJ alterations can be caused by changes in typical stimuli or tooth height, tooth misalignment, and the repetitive use of chewing muscles. A person who grinds his or her teeth frequently during sleep is more likely to do so. In some situations, the grinding is so loud that it causes others to be disturbed. Clenching. Someone who chews or clenches their teeth when awake. This might be gum, a pen or pencil, or your fingernails. The pain is caused by the constant beating on the joint, and stress is frequently blamed for jaw tightness, which results in a clenched jaw. Arthritis. Like other joints in the body, the jaw joint is susceptible to arthritic changes. These changes might be caused by joint disintegration, degeneration, or the natural wear and tear of aging. Degenerative joint disease causes cartilage to wear away and new bone to form on the joint surface. Cartilage degradation is induced by a combination of mechanical and biological processes, rather than by a single entity. As a result of recurrent microtrauma or microtrauma, as well as normal aging, it becomes more common. Immune and inflammatory illnesses help in the progression of the disease. The rheumatoid arthritis affects the TMJ by causing inflammation in the joints. The condition can destroy cartilage, erode bone, and finally lead to joint deformity as it advances. Rheumatoid arthritis is an autoimmune illness that affects people. It affects a range of organs and is characterized by chronic joint inflammation. It can cause TMJ problems, especially in young children. TMJ syndrome can also be caused by a joint infection, malignancy, or a congenital bone malformation. What are J syndrome symptoms and signs? Symptoms of TMJ syndrome are ear pain, ringing in the ears, tinnitus, and hearing loss. Pain in the jaw joints and facial muscles might extend to the neck and shoulders. Muscle spasms can develop if joints are overstretched. Talking, chewing, or yawning can all cause pain. TMJ condition can cause ear pain, ringing in the ears, tinnitus, and hearing loss. The pain normally occurs in the joint itself, in front of the ear, but it can also occur elsewhere on the face, scalp, or jaw, causing headaches, dizziness, and even migraine symptoms. TMJ pain is frequently misdiagnosed as an ear ailment, such as an ear infection, when the ear is not the source of the problem. When the joints move, they can make clicking, grating, and slash or popping sounds. Others may be able to hear you, and muscle spasms associated with TMJ syndrome may cause difficulty swallowing. A TMJ syndrome can also cause headaches and dizziness, potentially leading to nausea and slash or vomiting. Some individuals with TMJ syndrome may have a history of poor dentition or emotional distress. Can TMJ go away on its own? Remember that for most people, discomfort from TMJ disorders will eventually go away on its own. Simple self-care practices are often effective in easing symptoms. In one of TMJ problem, opening and closing your mouth major disc to move out of place. However, in another type of TMJ problem, opening and closing your mouth causes your disc to shift out of place. Medical conditions like arthritis can cause your joint to become inflamed and break down, while another variety can cause severe jaw muscle spasms. What is the best way to get rid of TMJ? The following tips may help you reduce symptoms of TMJ disorders. Avoid overuse of jaw muscles. Eat soft foods, stretching and massage. Your doctor, dentist, or physical therapist may show you how to do exercises that stretch and strengthen your jaw muscles and how to massage the muscles yourself. Heat or cold. Joint discomfort can also be caused by other health issues, such as teeth grinding while sleeping. Pain in the joint and surrounding muscles is the most prevalent symptom of TMJ diseases. Because the ear is so close to the joint, TMJ discomfort is sometimes misdiagnosed as an earache. How do I know if I suffer from TMJ? Symptoms: 1. Pain or tenderness of your jaw. 2. Pain in one or both of the temporomandibular joints. 3. Aching pain in and around your ear. 4. Difficulty chewing or pain while chewing. 5. Aching facial pain. 6. Locking of the joint, making it difficult to open or close your mouth. What are factors for TMJ syndrome? The National Institute of Dental and Craniofacial Research, NIDcr, which is part of the U.S. National Institutes of Health, are now conducting research to determine risk factors for TMJ syndrome in healthy people. TMJ syndrome may be caused by a number of physiological, psychological, sensory, genetic, and neurological system components, according to preliminary findings. New research will help us better understand how TMJ condition develops and progresses. New approaches to identify and treat the illness can also be developed. Some risk factors that have been discovered are listed below. Women are more likely than men to get TMJ condition. There may also be differences in how men and women react to pain and pain treatments. TMJ issues are more likely to occur in women between the ages of 18 and 44, according to studies. This is especially true for women during their reproductive years. There was no higher risk for men aged 18 to 44, and people who are more sensitive to slightly unpleasant stimuli have a higher risk of acquiring TMJ syndrome, according to studies. TMJ syndrome may be linked to genes associated with stress response, psychological health, and inflammation. Chronic discomfort. People who have chronic pain, such as lower back pain or migraines, may be more susceptible to TMJ syndrome. How long do TMJ symptoms and signs last? Once the injury or source of discomfort has been addressed, acute TMJ symptoms and signs might last anywhere from a few days to a few weeks before dissipating. If you have a chronic TMJ condition, you may experience weeks or months of severe or mild discomfort. Months to years. Is TMJ a medical or dental problem? Because TMJ can be a medical problem, a dental problem, or a combination of both, it is beneficial to understand what is causing the patient's disorder before creating a treatment plan. Is TMJ serious? If left untreated, TMJ disorder can lead to significant health problems, including chronic pain and inflammation. It can also cause bite issues, tooth erosion, and long-term conditions such as sleep apnea, insomnia, depression, and anxiety. Can TMJ affect your brain? Patients with temporomandibular disorder, TMD, perform poorly in neuropsychological tests of cognitive function. These deficits might be related to dysfunction in brain networks that support pain and cognition due to the impact of chronic pain and its related emotional processes on cognitive ability. What can TMJ worse? 4 surprising habits that worsen TMJ symptoms. Stress. Grinding/clenching of teeth. Jaw/head/neck injury. Osteoarthritis or rheumatoid arthritis in the TM joints. Dislocation of the soft cushion between the ball and socket. How to sleep with TMJ pain. Sleep back is going to be the best position if you suffer from TMJ, another TMD, or orofacial pain. Lying on your back has a number of benefits. It won't put pressure on the jaw. It will offer proper support to the head, neck, and shoulders. How I my TMJ naturally. Natural TMJ pain remedies. 1. Eat soft foods. One of the best ways to start finding relief from TMJ pain is by simply just eating softer foods. 2. Learn stress management. One of the top causes of TMJ is actually stress. 3. Wear a bite guard. 4. Limit jaw movements. 5. Try acupuncture or massage therapy. 6. Use heat or cold therapy. How long does TMJ take to heal? For most adults, the treatment averages anywhere from 18 months to 3 years. Therapies like massaging or stretching the jaw, stretching the neck, and stress reduction exercises can instantly provide some relief. Still, it may take anywhere from weeks to months to see the full benefits. What can a dentist do for TMJ? Treatment from an orthodontist can alleviate TMJ symptoms in many cases. If your TMJ comes from teeth grinding or clenching, your dentist may recommend that you wear a custom dental appliance. Often called a bite plate or a splint, this appliance will keep your upper teeth from grinding against your lower teeth. Don't eat hard or chewy foods. These include nuts, pretzels, popcorn, chips, gum, caramel, gummy candies, carrots, whole apples, hard breads, and even ice. Reschedule routine dental visits, like cleanings, if your jaw aches. If you have severe pain, call your healthcare provider. Can cause clogged ears? Since the TM joint resides adjacent to the ears, it's common to experience many TMJ symptoms in the ears. Patients can experience ear pain or clogged ears that they might pass off as an ear infection or allergies, but is actually from TMD. TMD can also cause tinnitus, ringing in the ears from nerve irritation. In contrast, TMD stands for Temporomandibular Joint Disorder. This refers to a number of different issues that can cause issues with your temporomandibular joint, TMJ. TMJ refers to the joint itself, while TMD refers to the various conditions and issues that can affect the functionality of the TMJ. Does TMJ get worse over time? Temporomandibular joint disease, or TMJ, is a complex condition that often worsens over time. Typically caused by the misalignment of the teeth, TMJ can erode the joint capsule between the skull and the jawbone. It is tricky to diagnose, and some people suffer for years. When should you see a doctor for TMJ? The following signs indicate that you may need to seek dentist care for a TMJ disorder: facial, jaw, or ear pain, pain in the neck and shoulders, popping, clicking, or grating sounds when you open or close your mouth. How do ear professionals diagnose TMJ syndrome? Medical history. The doctor will inquire about the following when diagnosing your jaw problem. What kind of discomfort are you experiencing? Does it seem like a dull ache, a throbbing discomfort, or a sharp stabbing pain? Is the discomfort constant or intermittent? Can you draw a circle around the painful spot on your face with your finger? What relieves the discomfort? What makes the agony worse? Do you clench or grind your teeth? Do you bite your nails or chew on things like pens or pencils? Do you talk on the phone for long periods of time with your shoulder against your ear? Do you chew gum frequently? How long will it be? Have you got any other oral habits that you haven't mentioned? Physical examination. During the physical examination, the doctor will examine your head, neck, face, and temporomandibular joints, noting any of the following: pain and its location. Sounds such as clicking, popping, grating. The mandible, lower jaw, range of motion, whether it is easy to open and close, if it can move from side to side and forward backward without any pain. Your assessment of pain on a scale from 0, no pain, to 10 while the jaw is being manipulated. Wear and tear on the buccal cusps of the mandibular teeth, especially the canine teeth. Rigidity and slash or tenderness of the chewing muscles. And how your teeth align together. Are the teeth normal? Is there an open bite, crossbite, or overbite? Have you had dental restorations? And is there a facial bone deformity? Depending on what the doctor feels is causing the TMJ syndrome, blood tests such as a white cell count and other tests may be ordered to rule out lupus, rheumatoid arthritis, or gout. Imaging. X-rays of the mouth and jaw may be done. TMJ function can also be evaluated with ultrasound. It can be utilized to assess the TMJ inside. CT or MRI scans may be conducted if the diagnosis of TMJ syndrome is unclear or if another illness is suspected. The soft tissues and the interior of the joint can be assessed using an MRI scan. A CT scan can be used to evaluate the bones and muscles. Experts say that MRI is the study of choice in uncertain instances because it is useful in evaluating TMJ illness. In rare circumstances, if all of the aforementioned tests fail to diagnose TMJ condition and pain persists, the surgeon may clean and irrigate the joint with a needle arthrocentesis. Are there home remedies? TMJ condition is self-limiting in the vast majority of instances. When the jaw is relaxed, most of the symptoms go away in 2 weeks. TMJ condition can be treated at home in a variety of ways. Aspirin or acetaminophen, Tylenol or ibuprofen, Motrin, Advil are anti-inflammatory and pain drugs that may help. Stick to a soft food diet. Chewing gum and consuming hard candies or chewy foods should be avoided. Do not chew with your mouth open. Gentle muscle stretching and relaxation activities may be demonstrated by your doctor. Stretching techniques may aid in the management of stress and the relaxation of your jaw, as well as the rest of your body. What is the best muscle relaxer for TMJ? What is the best medication for TMJ? Best medications for TMJ. Skeleton skeletal muscle relaxant oral. Flexural skeletal muscle relaxant oral. Mobic, meloxicam. Non-steroidal anti-inflammatory drug. NSAID. Oral Botox. Onabotulinum toxina. Skeletal muscle relaxant injection. What happens if you leave TMJ untreated? Although not life-threatening, if TMJ disorder is left untreated, it can contribute to significant discomfort and tension. Chronic pain can even lead to the development of diseases like anxiety and depression. Will TMJ show up on MRI? Magnetic resonance imaging, MRI, is one of the best diagnostic tools for identification of TMJ pathology, allowing evaluation of TMJ disc position, morphology, mobility, extent of joint degenerative changes, inflammation, and presence of connective tissue/autoimmune diseases. Does TMJ show up on brain MRI? Abstract. Magnetic resonance imaging, MRI, is an excellent method for examining the temporomandibular joint, TMJ. Can TMJ affect your eye? Blurred vision. Much in the same way that TMD can cause hearing problems, the disorder can also result in vision issues. Inflamed nerves behind the eyes can lead to blurred vision, eye twitches, and light sensitivity. Can TMJ be cured permanently? Clenching and grinding of teeth are two of the major causes of TMJ pain. However, this is not an irreversible condition, and with proper treatment, one may be able to cure TMJ pain permanently. For starters, you must stop any habits of teeth grinding or clenching, and anything that puts pressure on the joint. What are TMJ treatment options? A collaborative approach is frequently necessary for persistent TMJ condition. A dentist, ENT surgeon, pain specialist, physiotherapist, and primary care physician may all be involved. Splints, physical therapy, psychological counseling, acupuncture, hypnosis, and arthrocentesis are some of the methods utilized to reduce discomfort and restore TMJ function. Antidepressants, muscle relaxants, and prescription-strength opioids are some of the medications that can be used to treat pain. To reduce muscle spasms and pain, botulinum toxin, Botox, can be administered alone or in combination with other treatments. A variety of appliances can be used to treat bruxism. These splints are custom-made to assist transfer the force of the teeth while biting. Your doctor may recommend a splint or bite plate. Similar to a sports mouth guard, this is a plastic mouth guard that goes over your upper or lower teeth. When worn at night, the splint can help to prevent teeth clenching and grinding. This will assist in the relief of muscle tension. The splint should not cause discomfort or aggravation. If it does, stay away from it. Surgery. When it comes to TMJ syndrome, surgery is never the first option. Arthrocentesis is a procedure that involves cleaning and irrigating the joint with a needle. The surgeon may inject a local anesthetic or steroid into the joint during the surgery. When a TMJ internal problem is suspected, arthroscopy surgery is performed. It does necessitate anesthesia and has a good success rate in terms of pain relief. Physical treatment is recommended for anyone who has recurrent or chronic TMJ condition. The therapist can assist with joint mobility, muscle strength, and pain relief. A variety of other treatments is also available for chronic TMJ syndrome and includes friction massage, transcutaneous electrical nerve stimulation, TENS, and cognitive behavior therapy. The National Institute of Dental and Craniofacial Research, nidcr, advises that if surgery is recommended, you seek other independent opinions before proceeding. Generally, experts recommend the most conservative and reversible treatment possible based on a reasonable diagnosis. nidcr advises that other irreversible treatments have not been proven effective and may potentially worsen the condition. These include orthodontia to change the bite, restorative dentistry, and adjustment of the bite by grinding down teeth to bring the bite into balance. Follow-up TMJ. Follow your doctor's specific instructions for taking any medication prescribed and for home care with compresses or gentle jaw exercise. You may be advised to see a specialist such as an oral and maxillofacial surgeon, a general dentist, or a pain management expert. When the jawbone, mandible, is out of line with the skull bone, maxillofacial surgery may be required. TMJ condition is frequently diagnosed by dentists. They are used to conservative therapies. TMJ syndrome can be diagnosed and treated with the help of specially qualified facial pain experts. Is there a way to prevent TMJ syndrome? If you have occasional bouts of jaw pain, avoid chewing gum or biting on objects, such as pens or fingernails. Avoid eating hard or chewy food. When you yawn, support your lower jaw with your hand. Avoid large bites while eating. Regularly massage your jaw, cheeks, and temple muscles. If you feel spasms, apply moist heat. Maintain good sleep posture with neck support. Avoid cradling the phone between your shoulder and neck. See your dentist if you grind your teeth at night or find yourself clenching your jaw. The dentist can make a splint for you. What is the prognosis of TMJ syndrome? Most people respond well to conservative treatment, such as jaw rest or the use of a mouth splint. Treatment success is determined by the severity of the symptoms and how well you adhere to the treatment plan. Only approximately 1% of TMJ syndrome patients require joint replacement surgery.